Hello, my name is Dr. Maizel, and I'm one of the retina specialists here at Mid-Florida Eye Center. I'd like to talk about the retina. The retina is extremely important to sight. Anything that goes wrong with it can seriously affect your vision. Think of the retina as like the film of a camera. If the film is damaged, the camera will not take a clear picture. It's the same with your eye. If your retina is damaged, the picture that comes out of it will not be clear. Diabetic retinopathy is a major cause of poor vision. The longer you have diabetes, the higher your chances of developing it. If you have diabetes, make sure you see a retina specialist to carefully evaluate the back of your eye. You could be developing retinopathy and may not even be aware of it. Diabetic retinopathy is the leaking of blood and fat cells into the retina. The excess blood needs to be stopped to protect the vision. People with diabetes may not notice any loss of vision for many years, but the disease can still be causing silent retinal damage that can lead to blindness. For this reason, people with diabetes need to visit an ophthalmologist regularly. There is good news for patients with diabetic retinopathy. New drugs and therapies are consistently being researched and studied for their effects on this common disease. We are proud to offer these treatments to our patients. We have found excellent results with a newer FDA-approved drug recently released. If you suffer from diabetes, be sure to talk to your ophthalmologist about new treatments that may be effective for you. This is important because new treatments have recently been developed that can save your vision. Let's talk about macular degeneration, also known as AMD. It's the #1 cause of blindness in people over 50, so it's a very serious condition. There are 2 types of AMD. The dry type is the most common. I'd like to talk about that. Basically, it is the aging of the macula, the center of sight. AMD causes a loss of central vision. Many people with AMD still have good peripheral vision. Once the vision is lost, we are unfortunately not able to recover that lost vision. However, we may be able to protect further loss of vision. That is why it's very important to keep your appointments with your eye doctor. We need to keep a close eye on the macula to make sure there are no changes. Should we notice changes, we need to address them quickly before any vision loss takes effect. Up till now, we have not been able to do anything for this type of macular degeneration. But I have good news. We finally have new treatments that are being studied for this condition. This is exciting because we will hopefully be able to help our patients with this problem. We are now able to offer vitamins that have been proven to assist in the healing and prevention of dry macular degeneration. We are also proud to be able to enroll patients in research studies that offer treatments and therapies for patients that meet the criteria. If you have a family history of macular degeneration, you certainly need to get an examination every 6 months to a year to look for the signs of early macular degeneration. The retina is made up of several tissue-thin layers. Sometimes an injury or the effects of diabetes or another disease can cause 2 of these layers to tear and separate from each other. This is called a retinal detachment, and it can lead quickly to blindness. You must contact your ophthalmologist quickly if you see flashes of light in your vision. Another emergency situation is when a patient has a black curtain in their vision. This curtain is a possible retinal detachment and needs to be addressed immediately. In most cases, your retina specialist can reattach the torn retina with a simple laser procedure. However, surgical interventions may be necessary depending on the severity of the condition. Perhaps you have noticed small dark or transparent specks floating around in your vision. Normally, these floaters do not signify a disease or serious eye problem. They are simply particles of natural eye tissue drifting around inside the eye, which casts shadows on the retina. Floaters are usually harmless, and normal. However, it's important to understand and be aware of certain eye conditions, such as retinal detachment, that can cause a sudden and visible, noticeable shower of floaters. Anyone who notices such a rapid increase in floaters should see a retina specialist immediately. If you have these symptoms, it's very important to have a thorough retinal examination to make sure there is no damage inside your eye. If there is a tear in the retina, it can be easily treated with laser to prevent any loss of vision. But the only way to know if you have a tear is to come in and have a good retinal exam. One of the most common complaints patients see their doctor for is floaters. They can take many forms. Some people see veils or spots, some people see cobwebs, but they are all caused by the same problem: opacities in the vitreous gel of the eye. If you find these very debilitating or annoying, you don't have to live with them. With the amazing advances in retinal surgery, they can all be removed with less risk than ever before.